Well, June is Men's Health Month, and more often than not, men just tend to ignore their health until it's too late. Now, one of the most overlooked health issues that can be a sensitive issue for some men is testosterone. Well, here to talk about that is physician associate with PremierU, Destiny Petrowich. Destiny, thank you for coming in and talking with us today.
Thank you for having me.
You're welcome. Now, we talk a lot about women's health when we come on here, but men can face the same kind of hormonal issues. I mean,
Absolutely.
Not the same, of course, male. What are those issues that they can face?
You know, one of the biggest that I see is a lack of optimization or deficiencies in a really important male hormone, testosterone.
Okay.
So, you know, testosterone is the most prominent reproductive hormone in men, and I think it's oftentimes misunderstood as a hormone that's only for bodybuilders or people who are in the gym and want to gain a lot of muscle. But testosterone is important for the regular dad and the bodybuilder, right? Testosterone is important for a lot of processes.
Okay. Well, is it responsible for several of those things? I mean, I understand that men who lose testosterone can begin to gain weight. I mean, it causes a kind of a ripple effect.
Absolutely. So, you know, although testosterone, it is really important for things like gaining muscle, right? It's also important for just kind of daily vague symptoms when it's not optimized. So things like fatigue or sleep disturbances, depression is a big one. You know, the sexual dysfunction can be a part of it too. And, you know, it is a hormone that is very, very important and oftentimes not evaluated effectively.
Sure. Now, is this a common issue among men, or is this something that's like very singular to one man?
Yeah, it's so common. We see, you know, the studies show that men after the age of 30 are losing 1% of their total testosterone every year. So this is happening every year, and you begin to feel worse and worse and worse. And it doesn't have to happen, right? You just need to, you know, visit a provider who can help.
Yeah, well, that's what I was going to ask you. That was my next question. So how do you figure out, I mean, is it a culmination of symptoms and then reaching out to your doctor? What do you do?
Absolutely. So I recommend reaching out to a hormone specialist, and it's as easy as a blood test. And so we can draw labs, we can, you know, evaluate those together and then be able to make those clinical judgments and decisions on if you would benefit from testosterone therapy. The men who I'm able to treat, and you know, their lives are changed. They feel so much better.
I bet. Well, I mean, and they just feel more like themselves.
Absolutely, right? They say, I feel better now at 40 to 50 than I felt at 25.
That's
makes a huge difference.
Well, for anybody who wants to learn more about testosterone or just getting a blood test to find out hormonally what's going on, where can they go?
Visiting us at PremierUMarion.com is the best. We have a lot of information out there about how to schedule consultations with our clinic, as well as just learning about testosterone optimization in general.
Okay. Are there any health tips or diet tips, exercising, anything like that that you can do outside of therapy?
Yes, absolutely. So, you know, if men are wanting to optimize their hormone levels, but are maybe not interested in directly replacing with medicine, our office can also help with that.
Okay. All right. So there are a multitude of ways that you can address this common issue.
Yes.
And it's not something that has to change your life.
Right. Absolutely. This can fit in with your life, right? Whether you are the really busy full working dad, you know, full-time working dad, or you're somebody who's, you know, in the process of preparing for a body competition, right? It's for all men. It's important for every man.
All right. Well, Destiny, is there anything else that you feel is important to add for our male viewers out there? Or for those of us who love those male viewers out there?
Absolutely. You know, my biggest recommendation is, you know, like you kind of started this with, as parents, as full-time working people, we often put our own health on the back burner.
We sure do.
And in order to be able to be our best versions for our family and for our friends, we have to put ourselves first. And so being able to go to a provider that you feel like is really listening to you, addressing those concerns, it truly can be life-changing. And that is my goal as a medical provider.
All right, ladies, you heard her. Anybody who's experiencing these kind of symptoms, it's Father's Day this weekend. We need to make sure that they stick around with us for a little while longer, right?
Absolutely.
Destiny, thank you so much for coming in.
Thank you.
We appreciate it, and we always appreciate your health advice as well.
Oh, yes, thank you.